Welcome to the Omni Dental Podcast. Today, we're tackling something that, well, it can be a really tough experience losing a front tooth.
Oh, absolutely.
That main tooth right in your smile. Losing it hits more than just how you chew. It can really shake your confidence.
It's probably the highest stakes replacement we deal with in dentistry. I mean, replacing a front tooth isn't just about function. The aesthetics have to be perfect.
Perfect is the word.
Yeah, it needs to blend, completely naturally with the bone, the gums. Otherwise, it just stands out immediately.
Right. And that's why our mission today, our deep dive, is really into the sources around what seems to be the gold standard solution, the front tooth dental implant.
Mm-hmm.
We're going to try and unpack the tech, the health side of things, and how top practices actually deliver this. It's pretty complex stuff.
It is. And if you need the quick takeaway, the sort of bottom line, it's this.
Mm-hmm.
Things like traditional bridges, they compromise.
Mm-hmm.
They mean you have to alter healthy teeth next door.
Which is never ideal.
Never.
Mm-hmm.
And it actually speeds up decline in the structure. An implant, though, that's the only thing that essentially tells your body, hey, the root's still here.
Okay.
And that signal stops the jawbone from deteriorating, from aging prematurely. That preservation, it's absolutely critical. So let's set the scene a bit. Our sources point to a specific practice, Omni Dental. They're based in Arlington Heights, Illinois.
Right, 305E Rand Road.
That's the one. And they serve that whole area, Arlington Heights, but also nearby places like Palatine, Mount Prospect, Schaumburg, Wheeling, quite a few communities.
And the person leading the practice, Dr. Bayless Poles. The sources mentioned his DDS and, well, quite a bit of experience. Over a decade, right? Doing complex work.
Yeah, restorative general cosmetic dentistry.
Mm-hmm.
And when you're talking front tooth implants, that's exactly what you need, someone with surgical skill and that artistic eye.
That artistic aesthetic part seems really key here.
It really is. And Omni Dental, they're not just doing the basics like cleanings or, say, root canals. Their expertise goes into advanced stuff.
Like implants.
Exactly. Full arch implants, the all-on-4.
Yeah.
And also the prep work that's often needed, like bone grafting. We'll probably touch on that later.
Okay. And something that honestly kind of jumped out from the sources showing how they view the whole picture is that they also offer aesthetic services.
Yes. That's their sort of dental and med spa approach. It's quite integrated.
So things beyond just teeth.
Right. Think injectables like Botox or fillers, skin treatments, hydrofacials, even permanent makeup. It might sound surprising at first.
A little, yeah.
But when you're fixing a front tooth, you're actually working on the aesthetics of the entire lower face.
Ah, that makes sense.
So having those other services available means they can make sure the dental work really harmonizes with everything else, with the facial symmetry. It suggests they're focused on that final natural look, not just, sticking a post in the bone.
Okay, that link between the overall look and the surgical detail, that's a perfect place to start unpacking the tech itself. So a front tooth implant. What are we actually talking about? What materials, what processes make it so, well, permanent?
Fundamentally, we're rebuilding the entire tooth, starting with the part you don't see, the root.
Okay.
So surgically, a small post, usually made of titanium, is placed right into the jawbone where the old root was.
Titanium. Why titanium?
It's incredibly biocompatible. That just means our bodies don't see it as foreign. There's no rejection response, which is obviously crucial.
So the body just accepts it. How does that make it permanent?
Well, that acceptance allows for this amazing biological process called osseointegration.
Osseointegration.
Yeah, it sounds technical, but it just means the bone cells actually grow onto and fuse directly with the titanium surface.
Yeah.
It's like the bone literally bonds to the implant.
Wow, like welding it in place almost.
Pretty much. It creates this incredibly stable, solid foundation, a permanent artificial root that's just as strong, if not stronger, than the original.
And then once that's solid, that's when the tooth part comes in.
Exactly. Once everything's healed and that fusion, that osseointegration is complete, then the custom-made crown, the visible tooth part, is attached.
How does it attach?
Usually with a small connector piece called an abutment. And that crown is crafted very carefully to match the color, the shape, the size, even the texture of the teeth next to it.
Now, you mentioned front teeth being high stakes. Is there a difference between putting an implant in the front versus, say, a back molar? The demands must be different.
That's a really important distinction. A huge difference. In the back, function is king. Strength, cueing power.
Right.
In the front, it's all about aesthetics. We're talking fractions of millimeters making a difference. The challenge isn't just getting the post in the right spot, although that's critical. It's managing the gums, the soft tissue around it.
Ah, the gum line.
Precisely. Often the surgeon needs to do what's called gingival contouring, basically sculpting the gum tissue so it frames the new crown naturally. If that gum line looks unnatural, or if you can see even a hint of the metal underneath,
The whole thing looks off.
the whole aesthetic fails.
Yeah.
That's why it takes real experience, real artistry, especially up front.
So the look, the aesthetics. That's obviously huge for a front tooth. You want it to be totally invisible when you smile.
Completely undetectable. That's always the goal.
Yeah.
And that long-lasting, seamless look comes back to the titanium and that osseointegration we talked about. Once it's fused, that foundation is incredibly strong. It can last for decades with proper care.
Decades, wow. But here's where it gets really interesting, I think. The benefit that maybe doesn't get talked about enough, the preservation of jawbone health.
Yes. This is so fundamental and often overlooked. It's not just cosmetic, it's structural.
Explain that a bit more. Why is the bone so important?
Well, think about your jawbone. Your natural tooth roots stimulate it constantly through chewing, biting, just normal function. That stimulation signals to your body, hey, this bone is needed here.
Okay, like exercise for the bone?
Kind of, yeah. But when you lose a tooth, and especially the root, that stimulation stops in that area.
And the body notices.
It does. The body is very efficient. If it thinks bone isn't needed somewhere, it starts a process called resorption. Essentially, it starts dissolving or melting away that bone because it's not being used.
Oh, wow. So the jaw actually shrinks.
It does, both in height and width over time. This shrinkage doesn't just affect that one spot. It can make adjacent teeth shift, change your bite, and even alter your facial profile, giving that sort of sunken look sometimes.
That's incredible. So the implant is crucial because it replaces the root's job. It keeps that stimulation going.
Precisely. The implant provides that necessary mechanical load, tricking the body into thinking the natural root is still there, keeping the bone healthy and dense.
So it stops the deterioration.
It stops it. And that makes the implant a truly permanent solution, supporting not just the new tooth, but the whole structure around it for the long run. And, preserving that structure directly translates to a better quality of life. You can eat normally, speak clearly, smile without feeling self-conscious. It's huge. Understanding the actual process helps too, I think.
Sure.
Demystifies it. It's definitely a journey, multiple stages, not a single appointment fix.
Right. So walk us through it. If someone's thinking about a front implant, what are the steps they typically go through?
Okay, first step is always a really thorough consultation and planning phase. This isn't just a quick look. It involves detailed exams, maybe x-rays, and often advanced imaging like 3D CT scans.
Where are the 3D scans?
For precision. Especially for front teeth, you need to map the bone exactly, find the perfect angle and position for the implant to get that aesthetic result. Then comes the actual surgery, implant placement. The titanium post goes in, usually under local anesthesia, so it's comfortable.
Okay, but then there's the waiting, right? For a front tooth, losing it and then having to wait months for the final one sounds, well, difficult visually. How is that handled?
That's a very common concern and a valid one. The next phase is healing and osseointegration, where the bone fuses to the post. And yes, that can take anywhere from, say, 3 to 6 months, sometimes longer.
So a gap for months.
No. During that healing time, the dentist will almost always provide a temporary restoration. It could be a lightweight temporary bridge, or maybe a removable thing that looks like a tooth, something purely for aesthetics.
Ah, okay, so you don't have to walk around with a missing front tooth.
Definitely not. The goal is to maintain your appearance while the important work happens underneath. Then, once the implant is fully solid and integrated, the final step is crown placement, attaching that beautiful, custom-matched, permanent porcelain tooth.
Got it. So who's actually a good candidate for this? It sounds like you need the right conditions.
You do. The criteria are fairly strict because success really depends on having a healthy environment for the implant. Obviously, you need to be missing that front tooth, maybe due to injury, decay, gum disease.
What else?
Healthy gums are essential. No active periodontal disease. And crucially, you need enough healthy jawbone, enough density and volume to actually support the implant securely.
What if you don't? What if some bone has already been lost there?
That doesn't automatically rule someone out. That's where procedures like a bone graft come in.
Okay.
If the bone isn't sufficient, the specialist can add bone grafting material to build up the site first, creating that strong foundation needed before placing the implant.
So it's fixable sometimes.
Often, yes. And finally, Good overall general health is important too. Conditions like uncontrolled diabetes or certain cancers can interfere with healing and make osseointegration less predictable.
All right, so let's say someone goes through the whole process. The implant is in, the crown looks great. What's the upkeep like? Is it a lot of work to maintain it?
Actually, that's one of the big pluses. It's surprisingly low maintenance in that sense. You basically care for it, just like you would your natural teeth.
So regular brushing and flossing.
Exactly. Good daily brushing and flossing are key. Sometimes, though, you might need slightly specialized tools, like specific types of floss or little interdental brushes, just to make sure you clean really well around the base of the crown, where it mites the gum.
Makes sense. And what about dental checkups? Still important.
Oh, absolutely essential. Non-negotiable, really.
Mm.
Regular professional cleanings and checkups allow the dental team to keep an eye on the implant itself, the crown, and importantly, the health of the gum tissue around it. Catching any potential issues early is crucial.
Any specific don'ts?
Just the common sense things you'd apply to natural teeth, too. Avoid chewing on really hard stuff like ice cubes, hard candy, things like that. The porcelain crown is strong, but it can still chip or fracture under extreme force, just like a natural tooth could.
Okay, so bringing it all together, if you compare the implant to other options, like maybe a traditional fixed bridge, the case for the implant seems pretty strong.
It really does. I mean, what it all boils down to is you're choosing the only option that truly replaces the whole tooth, root and all.
Yeah.
It's designed to be permanent, it's structurally sound, and it actually benefits the surrounding bone biologically.
And that key point about not damaging other teeth.
That's huge. With a bridge, you have to grind down the healthy teeth on either side of the gap to use them as anchors.
Right.
With an implant, those adjacent teeth are completely untouched. You preserve your natural, healthy tooth structure while getting the most stable, long-lasting replacement possible. Hashtag #DOutro.
Well, this deep dive really underlines it. The front tooth dental implant stands out as, well, a really sophisticated long-term solution, especially when appearance is just so critical right there at the front of the smile.
Mm,
It seems clear that success hinges on, careful planning, real surgical expertise, and that special attention to the aesthetics needed for that area.
it does.
Mm.
And maybe here's a final thought for you, the listener, to consider. Think about how practices like OmniDental, the ones integrating advanced tech, like those 3D scans we mentioned, with a broader view of aesthetics.
Yeah.
Think about how that whole approach is changing the game for patients. It's not just making the treatment itself more accurate or efficient. It's fundamentally boosting the confidence and comfort you feel throughout that whole, sometimes lengthy restoration process.
That's a great point, making the journey itself better.
Exactly.
So, if restoring your smile is something you're considering, the clear next step is talking to a dental professional, getting that detailed evaluation to see what's right for you. And the practice we discussed, Omni Dental in Arlington Heights, their number is 847-483-8833.
That's 847-483-8833.
Thanks for diving deep with us today.